Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about breast cancer, and joining me is Dr. Eric Wallace. He's with OU Physicians and OU School of Community Medicine, and you also are an Associate Professor in Internal Medicine.
Correct.
Welcome to the program.
Well, thank you very much, Pam.
Now, before we start talking about breast cancer, clarify for our viewers about internal medicine. What is internal medicine? What do physicians do? And end up telling us whether you could be our primary doctor as well. So what is internal medicine?
Well, after medical school, students can choose to go into a variety of different fields, and internal medicine is a certain specialty you can go into to do your residency training. Internal medicine, more simplified, is a doctor for adults. And you can choose to complete your internal medicine training and become a primary care physician. You can be which works in clinic, you can be a hospital-based physician, or you can go into subspecialty training to become a cardiologist, a gastroenterologist, endocrinologist, and so forth. So there's a lot of different specialties you can go into after your basic internal medicine training.
So with internal medicine then, in terms of a primary doctor, it sounds like we can have an internal medicine physician as our primary.
Absolutely.
And that would be males as well as females.
Correct.
Because you're just that general in terms of what you look at with our conditions.
Yes.
Okay, that's always good to know.
Okay.
Now let's look at breast cancer. Talk to me a little bit about, in this country, is this a really big phenomenon? Do we find breast cancers are on the rise? Are they decreasing? Are they about the same? What does it look like in general?
That's a very good question. And the first point I wanted to make today is that I am not a woman. And the reason I make that point, and hopefully it's obvious that I'm not, but the reason I state that is for a couple of reasons. Number one is that I am at a very low personal risk of ever developing breast cancer.
Okay.
However, I know that breast cancer is a very common illness that's out there, and it's a very emotional topic for a lot of women out there. But it's also a very emotional topic for men as well. So even though I may not be at a personal risk of developing breast cancer, my wife, my mother-in-law, my two daughters are certainly at risk of developing breast cancer down the road. So this is a topic I do take very seriously. And I want to make sure that the public understands what the true facts are about breast cancer.
Okay.
You know, if you start with the incidence of breast cancer, about 150,000 women every year are diagnosed with breast cancer.
Wow.
And about 40,000 women every year die from breast cancer. So it is the second leading cancer killer among women in this country.
Oh my goodness, and that's probably a fact that sometimes people don't really realize, because we hear about heart disease and other kinds of conditions and other kinds of cancers, colon cancer and all kinds of things, but for women, breast cancer is about the second cause of death.
Among cancer, lung cancer is still by far number one.
Okay, but among the
killer.
Cancers,
Yes.
it's the second.
Yes, it is.
Okay, now tell me a little bit about breast cancer, because as you said, as males need to understand this too, because sometimes they can be instrumental in working with their loved ones or companions or whomever that of course are female. Males are at a slight risk, and we can talk about that a little bit. But when we think about breast cancer, tell me a little bit about how are we prone to getting it? I mean, is it more of a genetic link that needs to be pretty strong to sort of increase your chances? What are some of the risk factors? You know, do we need to eat more green vegetables? I mean, do we need to take more vitamin C? I mean, what is it?
Well, there's a lot about breast cancer that we still don't know, but the things we do know are, number one, your main risk factor for developing breast cancer is going to be age. As you get older, you become at higher risk of developing breast cancer. There are other components as well, including family history. So if your mom, your sisters, your grandmother, if they had breast cancer, there may be a genetic component to that may increase your risk as well. And there are other factors as well, how young you were when you had your first period, how old you were when you had your last period or when you went into menopause. And then there are other risk factors as well, but it's a combination of genetic factors and environmental factors. What all those environmental factors are out there, we still don't know the answer to all of those.
Okay, now when you talk too about the period, the menstrual cycle for women, some may be saying, well, that's something that we of course can't really control, how young you are when you first begin your menses or how old you are. So what tends to be the medical take on those age ranges, I mean, that increase potentially the risk factor? Because we do want people to know, just because we say risk factors does not mean you're going to get this.
Correct.
These are just things that may make you more predisposed to developing that, and you want to be more cautious. So is it if you have your menstrual cycle starting before the age of 10, 12? I mean, if you end up in menopause before 50? I mean, what are some parameters?
Well, a simple way to think about it is that the longer you have certain levels of estrogen in your system, that puts you at a higher risk of developing breast cancer. Because a lot of the breast cancers out there have estrogen receptors on them, and estrogen in a way can fuel the development and growth of a breast cancer. So if you start your period at a younger age and you end your periods at a later age, you have a longer period of years where you've had elevated levels of estrogen in your system. And on top of that, if you start hormone replacement therapy, there's been some data out there showing that starting on hormone replacement therapy, which has estrogen in it, can actually increase your risk of breast cancer.
Okay, let me ask this to get totally clear from the female perspective. Some people may pick that up, but I want to be really clear. In terms of the age, in terms of young and the estrogen levels you're talking about. So if the girl starts her menstrual cycle, say at 12 compared to 10, then she may have a little less risk factors because she's starting later.
Yes, maybe.
Well, yeah, maybe. That's what we're saying,
Right.
maybe. And then in terms of the menopausal cycle, if you end your menopausal cycle in menses earlier than someone else, maybe at 48 compared to 52, then you might be at a little less risk because that estrogen has declined. That's what you're saying.
Right, but that's if you're only focusing on that particular
Right, yeah, I just
aspect.
wanted to get that
Right.
one clear in terms of the age that you're talking about, because like you said, there are many risk factors. There are environmental ones that we don't totally understand.
Correct.
But just to sort of get a take on that one. Okay, now let me ask this in terms of smoking as a risk factor. We know that smoking is a risk factor, like I said, in lung cancer and some other things. Is this a risk factor in relation to breast cancer as well?
I don't think that they've proven any direct link between smoking and the risk for breast cancer development. But you're right, smoking is very much tied to lung cancer. Again, lung cancer being the #1 killer among women, but no direct link between smoking and breast cancer.
Okay, let me ask another question that women may want to know. Looking at birth control methods in terms of pills and things like that, sometimes people have heard, well, that can predispose you to cancers, and some have heard maybe that can protect you from cancers. Is there any conversation in the medical community really about birth control methodologies, pills, patches, or whatever's out there in terms of breast cancer?
Another good question. We do know that the use of birth control pills, which contain estrogen and progesterones, which is another form of female hormone, that those can actually reduce your risk of ovarian cancer. And ovarian cancer can be linked to breast cancer from a genetic standpoint, so it's important to get that as part of your history. But it's a good question as to whether or not the estrogen in birth control pills actually increases your risk or not. It's more tied to the hormone replacement therapy that's done later in life. But if you think about it just from a practical standpoint, any level of estrogen in your system can lead to an increased risk of developing breast cancer if those breast cancer cells that you're developing have estrogen receptors on them. Most of them do, but not all of them do.
Okay, well, we're going to take a really quick break and come back and talk a little bit more detail about breast cancer and the screening and all these other things.
Okay.
Okay, please stay with us. We'll be right back.